This is part 3, or the final section on age-appropriate dentistry, and what we're going to focus on this video is an alternative to a partial denture, bridge, or dental implants, and this is especially true in the mandibular arch. And the procedure that we're going to talk about is a resin-bonded, open-face metal splint that's called the Periodontal Splint. And remember, at the earlier ones we talked about bonding, and this is another application to the bonding technique. The Periodontal Splint was developed here in Memphis, Tennessee by my good friend Bill Priester, and we began doing this 50 years ago. But unfortunately, this has never been published. Dentists are not aware of this, and it is hopefully doing this video, this will become a much more commonplace procedure because it does work. It's very important that any technique done needs to be aesthetic, it needs to be kind to the periodontium, must be simple to do. So does this technique meet these objectives for what we refer to as periodontal splinting? It stabilizes the teeth and prevents the migration of movement of teeth. It also permits the patients to perform very effective oral hygiene to remove dental plaque. It is non-irritating to the soft tissue, the lips, the cheek, the tongue, and so forth. And it requires only a minimal amount of tooth structure being reduced. And remember, in the initial video, we talked about minimally invasive procedures, and this certainly comes under that category. And it distributes the forces over many more teeth rather than stressing one particular tooth. It is very aesthetically acceptable, as you can see, and the technique is simple to perform and more affordable to the patient, especially the older, mature patient that we have been discussing in these series of video lectures. This is an example of a case on the left that was treated 46 years ago, and you can see the amazing amount of bone loss. Yet this is very aesthetic, it's very stable, and we will show you some clinical pictures of this a little later. This can also be done to replace a missing tooth. Here we see a single tooth missing in the lower anterior, and certainly it could be replaced by a lower partial denture, and that would be an awful lot of metal in the mouth just to replace one tooth. Or you could take out those two central incisors, remaining teeth, and do a bridge on the eye teeth or the canine teeth. Placing an implant in a space this small is almost impossible. So if you're going to do implant therapy, you would necessarily take out two salvageable teeth to create enough space to place two implants and use an implant bridge. And on the right we see the lingual view. And here we see, with the Periodontal Splint in place, how this tooth was replaced, and you have a very aesthetic, simple treatment option on that, which is certainly appealing to the more mature patient. Now, here is what makes the Periodontal Splint work. You can see that there is a bevel on the tongue side of this, and that bevel should be about 1 to 2 millimeters. That is the key to success. Now remember, we talked about bonding. And when we bond, we go in there, and the bonding material not only binds to the tooth, but it comes over that area, and you will note that the area where the bevel is on the lingual side of the tooth has been etched, is not smooth, so the bonding material will attach much better to it. The black represents the bonding on the tooth, and the red represents the bonding on the bevel. So now you see the mechanics on this and how this works. And this is a case that I just showed you that was 46 years old, still functioning well, and certainly a very viable option to the options that we discussed earlier. Or as we look at it 42 years later, you can see the pink healthy tissue, you can notice the absence of bacterial plaque, and now we begin to see the importance of the simplest, least expensive mouthwash that we discussed in an earlier tape. ideal periodontal health, aesthetically acceptable. You show absolutely no metal, although you saw what is on the lingual of that tooth. You will notice that although a lot of root structure is present on this patient, no patient ever shows the lower teeth unless they really hold the lip down in a very peculiar fashion. And a Priester splint probably would be cost in the range of $3,000 to $4,000. But if we did implants down there, those other centrals would need to be extracted. A block graft would be done, which is a very difficult procedure to do, and certainly not one that the average general practitioner is going to do, and would need to be referred to the periodontist. 2 implants at $3,000 each, and then the crowns on the implants, $4,000 as the other, and you have got a $12,000 case fee, which would be much more invasive, very difficult to do, to have that treatment plan. And remember, with a Priester splint, this is a fixed restoration. But here we see a case in 2003 where implants were placed down there, and then 6 years later, we see around that the area where an infection has destroyed the tissue, and now we have the situation where the implant and the bridge is going to have to be removed. Now, we talked about it being a $12,000 treatment plan. What do you do now? Something that you should think about and suggest perhaps that in treating the lower anterior, you could ask your dentist about a Priester splint. You will get a response. They're not familiar with it, but then they can go to the video that we have on that, which is more involved on the Priester splint. Now, something to think about. First of all, we as dentists have a moral and ethical responsibility to provide information that will allow the patient to keep their teeth. If we do not fulfill this obligation, we're opening ourselves to potential lawsuits. Using this index fulfills your moral and ethical responsibility and protects you from lawsuits. Critical thinking. We are taught at the university by the American Dental Association to teach our students critical thinking. Unfortunately, in dental school, just showing dental students how to form basic procedures so that they can begin practice is all we can do. So therefore, critical thinking can be taught through these series of videos on the website that we talked about. Critical thinking is based on flexibility and, more importantly, on common sense. And common sense only comes with many years of practice seeing what works and what doesn't. Everything that I've shown you on these series of videos, not necessarily just the ones on age appropriate, but all the other videos that are on here are based not only on evidence-based data, but showing flexibility and common sense. And let's review several quotes that I have mentioned. Quote number 22 on my website. A treatment plan is a journey subject to change when circumstances change. It requires flexibility on the part of a conscientious and caring dentist, as well as a trusting patient. And we have pointed out how that applies on some of the cases on this series. Number 2, dentists present treatment options. Patients choose treatment plans. So always ask what treatment options are available. And if you are aware of a treatment option because you watched this video, please don't hesitate to let the dentist become aware of that, and maybe take 15 minutes to 20 minutes, depending on the length of the video, to see what he or she might do. And finally, when I was young, I had to force myself not to lie. Now that I'm old, I have to force myself to tell the truth. Hopefully, I have told the truth. I have not been critical of dentists or dentistry, because dentists are trained to treat defects. But some of these defects can be treated in a much simpler fashion than conventional treatment. So hopefully what I've shown you today will help you become a much more knowledgeable dental patient, and also perhaps use the things that you've learned to encourage your dentist to do procedures that perhaps he or she is not aware of.